Freedom Party. Michael, good morning to you.
Good morning to you, Gavin.
And thank you very much for joining us on the programme this morning. Michael, people may have seen some of the media coverage of an event which took place in Dublin on last Saturday week, the 22nd of August, widely reported as an anti-mask protest. Hundreds of people attended and you spoke at it. Why?
Yes, that's correct. Yes. I spoke at it, you said there was hundreds of people. It wasn't actually an anti-mask protest. It was organised by the Yellow Vests and by Health Freedom Ireland. I was asked to speak on specifically to address the issues of the Constitution and many of the things that have happened to us in regard to the ongoing lockdown, the ongoing restrictions that we're facing. And my concern is that many of those are not proportionate and they're not in accordance with the Constitution. I'm very concerned as a member of the Irish Freedom Party, and freedom is one of our main aims, that many of our freedoms are being unnecessarily restricted.
Okay, well, you know that we're living through a health crisis. So which restriction, is unnecessary?
I think that the government's position in the lockdown initially, which was one that I supported because I felt that we needed a 3-week break or thereabouts in order to get our hospitals and so on and so forth ready. But what we've now done is we've gone into overdrive, we have gone into an irrational panic mode about this particular crisis. And this is against the advice of many of the governments, many international advisors who believe that this is not a serious crisis. What we're not taking account of is the fact that the cure may be far worse than the disease, that the health implications of what we're doing in terms of not providing sufficient cancer assessment, not providing sufficient cancer care or coronary care, the impacts that we're having in education, the fact that we are borrowing up to 30 billion euros to fund something, to fund people who are now in unemployment, who are being funded by the government. This is going to have a catastrophic impact on our health service downstream, and not just on our health service but on our economy.
Okay, but we've seen over 2,000 people lose their lives on this island, and those deaths linked to COVID-19. That could have been a heck of a lot more if we didn't take the measures that we did. I find it hard to believe that I understand, yes, there are impacts of the decisions that have been taken, but surely people's health has to come first.
People's health is very important. Now, you mentioned a figure of 2,000 deaths on this island. 1,700 is the figure that's given for the Republic of Ireland. Yes. But that has been already refuted by HIQA, who said that at least 800 of those deaths are not actually related to COVID at all, but we're still counting them as COVID.
They talk about, I don't think they said they're over. I think they said that we've overestimated our deaths. But but even if it is just, and I'd say even if it is 1,100 people, that's a lot of people who've died.
What we have to do is look at the situation rationally. Are the excess deaths in Ireland in this year greater than they have been in previous years? Is the level of death that is resulting from this particular virus, is it significantly worse than in a bad flu season? And the answer is no, it's not.
Okay, but say that then, what about all of the people who have contracted COVID-19 and have been unfortunate enough to become very sick? That they, and some of them sick for a long time after they contracted the disease. That's not the flu.
Yeah, I think it's important not to trivialise this. No, certainly not, but it's also important not to over-dramatise it. And the level of this, the level of sickness is no worse than in a normal flu season, and we don't carry out this kind of activity for a normal flu season. Now, I understand why government, to some extent, panicked at the beginning of this, because nobody really knew what the COVID-19 was like or what it was going to be, or the extent of deaths that would arise. We were told at the very beginning of this process that no matter what we did, even with a severe lockdown, by the end of March we would have 15,000 cases. Every model we produced has been wrong. And that was proven to be wrong. And every model we've had has been wrong. And the government is now in a situation where it probably recognises itself that it has panicked, that it has made wrong decisions, but it's not able to get out of that situation. And it's making matters worse. And they're not prepared to admit that they've made a mistake. One of the reasons we had such excess deaths at the beginning of this process, and this is something that has happened internationally, is because we mismanaged the way elderly people were treated, particularly in the care homes. Now, you've also asked, would it not be far worse if we had not taken the lockdown measures? And I've only two words to say to that. One is Sweden and the second is Switzerland.
Sweden, which has had a higher rate of deaths than Ireland.
It is a slightly higher level of deaths, but the reason for that is because they have a higher proportion of older people.
They also have a more advanced healthcare system than we do in this country, and we're perhaps better equipped to deal with COVID-19 in the first place.
Well, perhaps to do. I couldn't comment on that. But Sweden.
Well, I lived in Sweden for a time. I can assure you they do.
Well, that's very good. But Sweden will admit that it made the same mistakes in Ireland in terms of elderly healthcare, and that's one of the reasons that they had a spike in deaths at the beginning. Now, what has happened internationally is that you've got a spike in deaths at the very beginning of the process, and then it evens off. And now we're getting panicked every day by these reports of the latest number of cases, but this is as a result of testing. A high number of cases is not leading to a higher number of deaths.
You sound very much like Donald Trump, Michael.
No,
fewer tests, fewer cases.
Well, the more tests you carry out, the more cases there are going to be reported. And is that something we should be concerned about? I don't believe it is.
But if considering the impact of this virus, I'm sure many people would disagree with you. Going back to that event, I know you said it's not an anti-mask rally, but there was a large crowd in attendance, and images from the day show the vast majority of those there were not wearing masks, were not adhering to the guidelines. Are you not undermining the public health message?
And the Guardian were present at that. Let's just say when I went to speak to this and I was invited to speak to it, I was surprised at the extent of the crowd that were there. But this is happening internationally. There was 130,000 people at a meeting, a similar rally in Berlin over the weekend. Something like 20,000 people at a rally in
And many people see those gatherings and despair because they fear that the virus will spread not just through those that are present, but through communities across the country when all those people go home and potentially bring COVID-19 with them.
But that's not happening. And there have been no spikes as a result of any of these meetings have been ongoing.
You said it yourself, with more cases in Ireland.
Throughout Germany in particular, but none of them are related to those particular events.
You don't know that for sure.
You can't. The health authorities are claiming that they have a way of identifying where the viruses are coming from. They're not related to any of those particular events. And there are no spikes that are taking place directly, 14 days after those events. None of those have been identified. But look, the Gardaí were present at that meeting. They did not. They actually corralled us into a certain area. There were far more than a few hundred people. Like I would say, 4,000 people present at it. It was a very significant meeting. People are very annoyed at what they've been asked to do. There's very little evidence that mask wearing is going to make any difference to people. There's very little evidence that it'll help stop the spread of any virus, and there may be significant negative impacts to it in terms of hypoxia.
Okay, I will point out you are an architect by profession. You're not a scientist. You're not a doctor. It's not your expertise. It's not mine. But why do you not trust the likes of NFIT, the likes of the HSE, who are experts in this area and who are issuing the advice for us to follow the guidelines?
Because there are many other experts who are giving very different advice, including many of the people who have worked in the British health system, like Dr. Mark Woolhouse, who has come out and said that the lockdown has been absolutely catastrophic.
But those people are they're in a significant minority when comparing the number of people making those views with the international evidence.
Yeah, but they are actually very senior people. One of the difficulties with medicine, as with science, is that when you're working within a system, it can be very, very difficult to buck the system. And people are very difficult to speak out against the system, even if they have personal reservations about it, because their jobs are dependent on it. I mean, that's a tendency, unfortunately, we have seen. But there are some very, very serious senior people, Nobel Prize winners, epidemiologists, people who have worked for the government and have now changed their mind and found that the lockdown has had very negative health impacts in terms of healthcare in other areas.
And we've heard, sorry to cut across you, we have time for time, but I just wanted to back up what you said. We've heard that from some doctors working in the Irish system who've talked about, and you referenced cancer, who talked about the impact there, and I fully accept that, but is it not the least worst option finally?
Well, that's what we've got to try to decide. And I think one of the problems with our system, when I first heard about this coming down the track, I was talking to a friend of mine, and he said, this COVID-19 thing is coming. I said, look, I'm not worried about COVID-19, but I am worried about the way we react to it. Because I think modern states have a great difficulty in reacting to crisis. They tend to be media-driven. They tend to be driven not by facts, not by rationality, but by fear and by fear of what they see in the papers. And, government has been panicked. They have made irrational decisions, and they're now not able to get out of it. And what we need here is a certain level of proportionality. We need to look at what are the real dangers and what are the implications in terms of business, in terms of healthcare, in terms of education of what we're doing, and is it proportionate in terms of the threat that we actually face. And I think if you do look at it rationally, and you do stand back for it, and let's forget the emotion, let's forget about people being angry, look at this rationally. Are we acting in a proportionate manner? And I don't believe that we are.
Colette is a retired nurse. The healthcare department are doing all they can to combat COVID-19. Michael, this is a sad opportunity to forward and progress your political career, she says.
Well, no, it's not, because I think what I'm enunciating is a somewhat minority view and possibly an unpopular view. I don't think it's going to particularly win me any votes. But I do believe that we're not acting in a proportionate manner. And I think anybody who stands up and announces a position can be accused of just trying to promote their political views. By the way, while I have an opportunity, I spoke at the meeting that our institutions are not standing up. They're not holding government to account. And our opposition party is not holding government to account. There's only one exception to that, as far as I can see, and that's Michael McNamara, who has asked serious questions about this, and I think he's the only one that is doing so.
Well, we will leave it there, because unfortunately we're out of time, but I appreciate you taking our call this morning. Michael Leahy, thank you very much for joining us.
You're very welcome.
Do let us know your thoughts at home, please.
If it matters to you,